And daily pediatric COVID-19 related hospitalization is in fact almost doubled in the last month. And as we know, the initial catalyst was Delta variant, and now it's substantially followed by a recent surge of the Omicron variant. And interestingly, if you look at the vaccination rates among the pediatric population, it just continues to lag. And we just have, I think even nationwide, about a third of our eligible kids between 5 to 17 years who have been vaccinated. And in fact, virus is now about the top 10 causes of death for children ages 5 to 11 years. And, American Academy of Pediatrics do report a sharp increase in this pediatric COVID-19 cases. And me working in a pediatric intensive care unit, I do see serious illnesses from COVID, although rare. The sheer number of new cases worries us. And when we talk about mortality in pediatric population related to COVID-19, since the beginning of the pandemic, it's over 120 cases. And although this seems less, I think every pediatric death is unique in its own way. It's very tragic. So I strongly advocate to follow precautions and to, advocate for vaccination. In terms of, severe cases that result in fatal outcome, there are children with high-risk population that involve kids with high-risk medical complexity, with neurologic conditions, metabolic conditions, cardiovascular disease, obesity, diabetes, asthma, sickle cell, and are very fragile kids who are on chemotherapeutic agents for their underlying cancer. So I think it's very key for us to recognize that although reportedly the symptoms could be mild to moderate, there are severe cases. The incidence rate is similar to those of adults, and we have to look at that more seriously and follow the necessary steps to avoid transmission, to protect ourselves, and to protect others in the community.